So my name is Nichelle Ruffin. I am currently a faculty member at the Department of Family Medicine for the Hospital of the University of Pennsylvania. I work in our outpatient clinic. I deliver babies on the labor and delivery floor, and I teach medical students. I grew up in Cleveland, Ohio. I went to public schools. I grew up in like a working class household. My dad was a police officer for Cleveland, and my mom was an administrative assistant for the FAA. I went to John Hay, Cleveland School of Science and Medicine for high school, which completely changed the trajectory of my life. I had a lot of support throughout the way, and I don't think I would be here today like without the connections that I built while I was in Cleveland. There are multiple programs at CSSM that I was involved in. One program was, I think it was like once a week where we would go over to Case at the School of Medicine and we would do kind of like an educational session with one of the doctors who worked there. And that's when I really, really thought, this is something that I can see myself doing. We would talk about really the depths of anatomy, deeper than any class that I had taken in high school up to that point. And we would talk about even different disease processes and how they develop and how they can be prevented and how they're treated on a basic level. But at that point in my life, I just was really, really interested in it. That is one of the major things for sure that sparked my interest in medicine in particular. And then another program that I was involved in was with some of the medical students at Case. They would host these sessions where kids throughout, I think it was all of CMSD, could come if they were interested in science or medicine and just learn more about the body, learn more about how things worked, learn more about biology. And since that was something that interested me, it was something that I kind of took advantage of. And I think it just kind of opened my eyes that like, this is very cool. This is something that I can do. This is something that I'm learning about already as a high schooler, and I want to continue to learn about it. So I think that's really what prompted me to decide to go down the medicine track. I'm the first medical doctor in my family. I had no clue what the process was of becoming a doctor. I thought that you had to like be a nurse and then become a doctor. I just truly had no clue what the process was like. And that's why I credit so much to my mentors and like the people that I met when I was at CSSM. I really appreciated the location of where it is because it's right in the center of the two, or I guess two of the three biggest hospital systems in Cleveland. It's like right next to university hospitals, and it's also right next to the Cleveland Clinic. So as a high schooler, it allowed me easy access to go to either of those places, either to shadow or to do learning. It's also right, like basically on Case's campus. So it allowed me easy access to take courses there, and take advantage of other educational opportunities because it was all within walking distance. Because I didn't necessarily live right in that community, it would have been a barrier for me if I had gone to school at a different place and then also tried to take advantage of some of the educational opportunities that exist at Cleveland Clinic and Case just because of transportation. It was a special experience for sure going to a high school that had a concentrated focus like that. And I think it was very helpful for me to be around other students who are interested in the same thing. But I think learning and being able to process the different like career options that were available with other like-minded people was totally invaluable. I think the fact that other people were also interested in math, science, medicine. We had a bit of a camaraderie there in terms of like my class and where we were going to go. And I remember going to Case and going to with other students from my school that I knew and I felt comfortable with, and taking advantage of these opportunities in a community that was very supportive. I would say the other thing is these kids, we were all smart. We all really enjoyed science. We all really enjoyed math as well. And so we kind of pushed each other. I remember in our classes, like I was trying really hard to have the highest grade in the class, to be the top person on the roster. And I think without that kind of friendly competition, and being around like-minded individuals who really valued school and education, I think my outcome personally would have been different if I wasn't in that environment. I know that the path to becoming a doctor would have been a lot harder if I did not go to the Cleveland School of Science and Medicine. The purpose of a school district in general should be to give the best education possible so that students can go on to have great and fulfilling careers. CSSM is preparing people to do well in college and not just average, to do well enough to be accepted into a medical school and then make it through medical school and residency and become practicing physicians. I think it really would be a disservice to just have a pathway or a track instead of having a dedicated school where it is right now in close proximity to hospitals and Case Western. Yeah, I think we'd be doing a disservice to the students of CMSD. I learned about the scholarship when I was at CSSM. I knew that I wanted to go into medicine. And so I thought it was interesting. Like it piqued my interest at first. And then, as I was like applying to colleges and things, it was really like, okay, now you have to really get serious about this. Like, are you going to apply to this program or not? And I knew that I wanted to apply. But in my mind, I did not think I was going to actually get the scholarship. I think where my hesitation started is when, I started to realize that, oh, there's a really good shot that I might actually get this scholarship. Um, I originally wanted to go away from home for college because I'm born and raised in Cleveland. So my hope was to go to a school that was out of state and kind of get a different experience outside of living in Cleveland. And so I did become very hesitant when I was realizing like, oh, I might get this scholarship. And I think it was through the encouragement, I'll say, of my parents to really like take it seriously. And we had many conversations. There were some tears when when it was like, okay, maybe I'm not going out of state for college. But I think my parents, and also I remember a couple of my teachers like pulling me aside at CSSM and talking to me about how amazing of an opportunity this was, um, and how I should take advantage of it. I think I brought a perspective of lived experiences that other people couldn't necessarily bring. It's one thing to read something in a textbook or to do a simulation or to think about issues in theory, but it's another thing to have family members who have experienced these things or to have lived these things myself. If you look at like the demographics of the city of Cleveland, like the actual city of Cleveland, and you look at like the average salary and you look at the distribution of race and wealth and education and all of these things, I do think that I better represented the majority of people who live in the city of Cleveland than a lot of my peers did. A lot of them were coming from other places, didn't know much about Cleveland, and so all they saw were these shiny buildings at the Cleveland Clinic or the campus at Case, when the actuality is that's a very small portion of what Cleveland actually is. And so I think being able to bring that perspective and that kind of real world kind of viewpoint of where we are, what is the work that actually needs to be done for the majority of the people who live in the city. I think it was so special and so needed. And I fear that there's not enough of that representation, not only at Case or at Case Medical School, but medical schools throughout the country. I don't think there's enough of that perspective. I honestly think it's easier for me to approach the average patient as if they were my family member. I have so many patients that are of like ethnic or racial minorities who come in and truly have a distrust of the medical system. I mean, they have high blood pressure that is uncontrolled, that they are not on medications for, and that they are very, very hesitant to start medications for because they don't believe that the things that the medical industry, the pharmaceutical industry, they don't believe that those things are healthy for their bodies. And as a result of that, that's how we get complications. That's why in these same ethnic and minority groups, the rates of strokes, heart attacks, deaths from cardiovascular disease are higher than they are in other groups. It's because these preventable steps were not taken in the beginning. I mean, I can tell you many examples from family members, but it hits as close as home. My father had untreated high blood pressure for most of his adult life, which resulted in him having a stroke at a young age. And thank God that he has almost fully recovered from it. But now he has other complications from that could have been avoided. So, and that's really why I wanted to go into family medicine, because I'm able to treat a lot of conditions that are preventable. And so we do like annual exams where we literally comb through patients' charts and we look at things that we need to do right now in order to prevent complications from happening in the future. And I find joy in that. Like I said, I treat my patients as if they're one of my family members, they're one of my friends. And I think, yeah, it's easier for me to do that because the population that I work with right now, I come from a very similar background. And so I think we have similar like lived experiences. I did residency at Penn as well in family medicine. And so I moved to Philadelphia. I spent 3 years in medical residency. My third year of residency, I became a chief resident, which is like something that you're elected to basically. And now I stayed on as faculty here at Penn. I was trained in family medicine obstetrics. So I work on the labor and delivery floor once a week, delivering babies and taking care of those babies after they've been delivered. I also do postpartum care for the mothers. I work in one of the community sites in Philadelphia once a week as well, one of the federally qualified health centers. And then I work at the Penn outpatient clinic 2 or 3 times a week doing primary care. I think that educationally, they supported me in like whatever I wanted to do. But I do think when I was looking at specialties, I was able to go into that decision with kind of a fresh and clear lens, knowing that I didn't have debt to pay back and that I could really do whichever specialty I wanted to do. I mean, I would have done whichever specialty I wanted to do anyway, which was family medicine. But having the scholarship and not having debt to think about afterward definitely played a role. It's amazing. I love it. I always say it's one of the few places where someone can be admitted to the hospital and they're like happy about it. But I love delivering babies. I love taking care of my patients. It's such a special and vulnerable place for a person to be during childbirth. It's such a special place to be let into um very very vulnerable situations, family dynamics, and people are so comfortable with their bodies around me. I think it's truly the epitome of like what medicine is. And there's such a discrepancy in the outcomes when you think about differences in race between Black and non-Black birthing parents and the infants as well, that I take it as really a special opportunity to be able to try to combat some of those disparities and just provide the best patient care that I can provide. I love it. It's one of the most fulfilling, it's definitely one of the most stressful parts of my job, but it's also one of the most fulfilling parts of my job. I really do love it. In medicine, there are a lot of personalities, and there are a lot of type A personalities, and there are a lot of people who are very smart. Sometimes I think in the medical education, there is a loss of like the human side of things. And I think that spills over to how we teach medical students. And I think the way that I kind of introduce myself when I'm meeting a medical student has changed as a result of how I learned. So I feel that my role in particular is to teach medical students not only the medical knowledge, that's a very important part of it, but also how to be empathetic with patients, how to hear and understand what patients are saying, how to meet patients where they are, how to help patients get the resources that they need in order to get the proper medical care that they need, and how to build a proper rapport with the patient. It's like I said, I have many patients who come to see me who have kidney disease or uncontrolled diabetes or uncontrolled high blood pressure. And it's not that they've never seen a doctor in their life. It's not that I'm the first doctor that they see ever. The problem is that they've gotten this recommendation, but the recommendation hasn't necessarily been packaged in the gift box that they are willing to receive. And if it's not in a form that folks are willing to receive, then you're just talking for nothing. For instance, I can't recommend a medication to a patient after the patient just told me that they don't like to take medications. It's just like, well, you're not listening to me, so I'm not going to listen to you, and my respect here is lost. So I think that I more recently have been just trying to teach students, let's really listen to understand what patients are saying. And it may not be a one visit fix. We may not, get their A1C under control in the next 3 months. But if we develop a good relationship and a good rapport with this patient, they'll keep coming back to see us.